You need to know what our program's goals are and decide if they match your goals in training. The LSU Ophthalmology Program's aims are to provide the highest level of medical and surgical training in ophthalmology, to create ophthalmologists who excel clinically and surgically and move the field forward, to produce ethical ophthalmologists who advocate for the highest standards of patient care, and to equip our graduates with the skills to become successful comprehensive ophthalmologists or be competitive in choosing the fellowship of their choice and then enter private practice or academic ophthalmology careers. LSU Ophthalmology has partnered with LSU Internal Medicine and other specialties to create a PGY1 internship year for our residents. The internship year consists of 3 months in ophthalmology, 2 of which are taken in the last 6 months of internship, 2 months of internal medicine wards, and 1 month rotation in specialties relevant to ophthalmology. These include neurology, radiology, anesthesia, OMFS, emergency medicine, rheumatology, and endocrinology and infectious disease. During this year, you will get to know our hospital systems and meet colleagues and faculty members in different specialties that will be able to help you in your education and patient care during your residency. We are a multi-site program. We cover Southeast Louisiana and also get referrals from West Mississippi. LSU Ophthalmology has 9 rotation sites. 5 are in New Orleans. 3 rotation sites are outside of New Orleans. These include Baton Rouge, which is about an hour and 15 minutes away from New Orleans, Lafayette, 2 hours away, and Houma, about 45 minutes away. Finally, there is a shared rotation between New Orleans and Bogalusa, which is about an hour away from New Orleans. Our New Orleans rotations are the LSU Eye Center, Ochsner Medical Center, University Medical Center, this is our home-based hospital, Children's Hospital, and the VA Hospital. We provide furnished apartments in our 3 away rotations, that is Lafayette, Baton Rouge, and Houma. For the Bogalusa rotation, residents commute to clinic as they do not take call at this location. For each training year, our residents are on away rotations 3 out of 7 rotations. Each rotation is 7 to 8 weeks long. We have different faculty at each rotation site, which allows us to have large representation of each subspecialty in our faculty roster. Our residents are exposed to a variety and different degree of pathology, witness different ways of diagnosing and treating the diseases, and learning multiple surgical techniques. It also allows them to get to know each subspecialty and decide if they want to pursue a fellowship, or gives them the armamentarium needed to run a successful practice as comprehensive ophthalmologists. We believe in graded autonomy. Our interns and PGY2 work under heavy supervision. PGY2s are allowed to perform procedures such as intravitreal injections, lasers, and extraocular surgeries. PGY3s get some autonomy always while having available staff to supervise. They take primary and backup call and start performing intraocular surgery. PGY4s take mainly backup call and perform mostly intraocular surgeries. Our surgical numbers exceed all the minimum numbers of surgeries mandated by the ACGME. The numbers shown on this table are numbers of cases performed by residents as primary surgeons with direct supervision of faculty members. We continuously strive to increase surgical numbers for our residents. The upwards trend was halted in the past 3 years due to elected cases being canceled because of COVID. We anticipate numbers going back up this upcoming year. We offer didactic sessions including grand rounds, morning report, question sessions, and lectures based on the BCSC books. We also have mentorship programs between senior and junior residents and small mentor groups with faculty members. We follow a surgical curriculum and have several sessions a year in the wet lab and eye simulator. What sets us apart from other programs is the education we provide in our clinical and surgical encounters, the variety of pathology, and the exposures to so many different attendings, which provides our residents with all the tools they'll need to succeed as comprehensive ophthalmologists or in their fellowships. Our program functions well as a team, and there is a sense of camaraderie between faculty and residents. We understand our job is to take good care of our patients, and we do so as a team. Our residents' well-being is also one of our priorities. We have several social activities throughout the academic year, and we see our program as a family. Faculty members are approachable, available, and interested in teaching. And best of all, you'll live in New Orleans for 4 years while having an excellent educational experience. You will find amazing restaurants in every corner. There are festivals throughout the year, music festivals and food festivals. Most of the time it's actually both. There are multiple sporting events, ballet, theater, music. There's no snow, and there's Mardi Gras. Best of all, your family members and friends will actually want to come visit you. Other information or frequently asked questions. Does the program have an eyesight simulator? Yes, we actually have 2 of them. Does the program have a wet lab? Yes, we do. Do the residents have to buy their own lenses? Yes, they buy their own lenses. Does the program provide copies of the BCSC books? Yes, we actually provide both the paper and electronic versions. Does the program have a research requirement? We do. We have a yearly research requirement. As a side note, the AO meeting comes to New Orleans every 4 years. I hope this presentation helps you get to know our program better to decide if it's a good fit for you. Again, we appreciate your interest in our program. I wish you the best of luck during this complex matching process and in the rest of your career as future ophthalmologists. Go Tigers!